Hi everyone, my name is Adam Hassani.
And I'm Aditya Venkat.
And today we'll be talking about the implications and applications of generative AI in healthcare and your investment portfolio.
So before we dive into all the nitty-gritty details of this investment, first let's understand exactly how private equity's been involved. Headline after headline after headline after headline just shows us that private equity is gutting America and getting away with it.
With this being said, we believe we need to ground any potential investment in ethics. So the ethical framework we chose was Immanuel Kant, who believes that people may be used as a means as long as they share in the ends. In this case, we view people, the stakeholders, as the patients and healthcare providers. Kant also speaks about the fact there needs to be a respect for autonomy, in which each individual has its own worth and dignity. Finally, Kant's famous quote that counsels of prudence are always subordinate to morality, in which logic will always be below ethics. So, for our presentation today, we'll first begin with an overview of the private equity industry in healthcare, our current investments. We'll then pivot to the current landscape and future of AI in specific applications of generative AI in healthcare today. Aditya will then talk about potential synergies from a potential investment in AI in the healthcare industry. We'll return to Immanuel Kant, and then finally we'll end with important considerations along legal, ethical, moral, and financial lines.
So let's just first orient ourselves in the right way to find out what private equity's involvement in healthcare looks like. Private equity as an industry is a profit-motivated industry. It's all about making money. But historically, when you involve this in healthcare, this means long-term mortality rates go up. Increased costs are put on patients. There's a lower quality of care and staffing shortages because you cut employees to save money. So as the private equity investment in healthcare continues to rise up to over $200 billion in 2021, we want to make sure that we try and understand what investment should look like. We see two possible ways of doing this. Number one, invest directly in companies that are developing medical AI. And number two, purchasing medical AI for current healthcare holdings. But what does AI look like right now? Right now, there are three prominent AI chatbots. Number one, there's ChatGPT. Number two, Google's Bard. And number three, Bing's chatbot. But they're pretty elementary. It's about text generation, information searches. Some of them can create pictures, which are pretty cool. But they're not sophisticated enough to actually solve medical problems. So this means that we're looking to AI for the future.
Currently, there's a large movement on Capitol Hill to regulate generative AI. In fact, the CEO of OpenAI, Sam Altman, the company behind ChatGPT, even testified before Congress arguing for the regulation of AI. As we know, AI is currently a completely unregulated industry, whereas the healthcare sector is arguably the most regulated industry in the US. We believe a dangerous precedent could be created when you meld an unregulated industry with a heavily regulated industry like healthcare, and patients' lives are at stake. So, returning to Immanuel Kant. AI is clearly the future, but how can we adopt a prudent approach to our healthcare investment? We know that the margin for error in healthcare is simply too thin. These are patients' lives at stake. Therefore, we believe that patients and people should be the priority. So, for a potential investment, we believe in instituting ethical guardrails based on a Kantian framework of weighing the means versus the ends. So now we'll pivot to some specific applications of healthcare, of generative AI in healthcare. The first we looked at was preventative care. As a private equity firm, you should definitely take note of this because we know that misprevention is costly. In fact, according to the CDC, 90% of the $4.1 trillion in annual healthcare expenditure is due to people with chronic illnesses and mental health conditions. Therefore, preventative care is key to preventing chronic health conditions and thus optimizing costs. We also looked at the application of telemedicine, generative AI in telemedicine and virtual health. With the onset of the COVID-19 pandemic, the use of telemedicine has skyrocketed, up 766% since the beginning of 2020. ChatGPT can serve as an online symptom diagnoser for historically underrepresented people who don't have access to healthcare. For example, Ativ Malhotra, a Harvard MD, explored ChatGPT's application as an online symptom diagnoser. Using ChatGPT was able to identify specific illnesses at a better rate than actual physicians and traditional online symptom trackers like WebMD. We believe this has applications for people with limited access to healthcare in the United States, the elderly, the uninsured, and for people with remote access to healthcare who live in healthcare deserts. Basically, in the United States, we know that 80% of people lack adequate access to healthcare, so generative AI can help improve patient outcomes for them. Finally, the most practical application we looked at was clerical work and productivity. We know the healthcare industry is document heavy. Physicians spend about 30% of their time simply entering patient data into portals. This has serious implications, with the US Department of Health and Human Services finding a nationwide shortage due to professional burnout, due to simply, clerical work. The result? More time spent documenting and less time spent with the patient. The solution? Generative AI. One such company doing so is Abridge, which describes themselves as a super intelligent sidekick dispensing suggestions to improve care. Basically, Abridge provides automated solutions to clerical overload, recording summaries of a patient's visit, generating a billing plan and treatment plan. It's actually currently implemented at the University of Kansas and University of Pittsburgh Medical Center, where over 1,000 physicians are using it. So with that being said, we'll now transition to synergies from AI in healthcare.
With all these amazing applications of AI to healthcare, how do we actually derive value from them? Those are the synergies. In preventative care, the baseline idea is that we see improved health outcomes through lower costs, lower hospitalization rates, and an early detection of risk factors. In fact, the World Health Organization says if you detect early, you can improve your chances of recovery from over 30 to 50%. In the telemedicine and virtual health space, the basic idea is improved access to healthcare and healthcare equity. Like Adam said before, 80% of the United States doesn't have adequate access to healthcare, and if we can improve that, we improve patient convenience and make it more cost-effective for doctors and patients across the US and potentially the world. Finally, in the clerical work and productivity section, the basic notion of Kant is to improve the humanity in everything. And if we can increase the doctor-patient interaction, we accomplish that goal. We can improve doctor fatigue by not bothering them with all the menial clerical work. We can improve waiting times for patients, because I've waited for 2 hours at the doctor's and it's just not fun. And finally, we can lower the cost for doctors and patients, which is really the primary concern of private equity firms. So, how does this still fit into our broader notion of Kant? Just as a reminder, these are our 3 main facets. Number 1, people may be used as a means as long as they share in the ends. A lot of data is going to be collected and put into algorithms and models. So yes, we might be treating people like data points, but at the end of the day, they are a means to a broader end that allows them to achieve better healthcare goals. Number 2, respect for autonomy. We are trying to make sure that individuals maintain their own worth and their own dignity by increasing the patient-doctor interactions. Essentially, we're trying to make healthcare more human and more dignified. Finally, counsels of prudence are always subordinate to morality. It might sound really complicated, but all it's saying is that money cannot be the sole primary motivator for healthcare or for private equity companies. All decisions must benefit the patient and the doctor.
So before we make our final recommendation, we have some important considerations when it comes to generative AI's applications in healthcare. The first is hallucinations. Hallucinations are basically the tendency of generative AI models to produce inaccurate outputs with almost 100% confidence. If you take a look at this example from ChatGPT. The issue with this is that, as Dr. Gregory Attor spoke to, in medicine, we can't tolerate hallucinations, especially when human lives are at risk. The next thing we looked at was model bias. Model bias is basically the exhibition, perpetuation, and amplification of human biases by AI models, often due to the flawed data sampling, which leads to over and underrepresentation in a data set. So imagine there's a model for predicting breast cancer rates, and it was trained on primarily white patients. This would make it an inaccurate model for predicting breast cancer in black patients. The result is that implementing biased models in healthcare can have serious implications for not only the quality of patient care, but also just making accurate diagnoses. We also looked at healthcare discrimination. So imagine, based on your health data, a model predicts you can have a 75% chance of being diagnosed with a chronic illness. Can insurance providers turn you away? This is an important question we have to consider, and one we don't know yet. And finally, we looked at patient privacy and data ethics, especially when it comes to HIPAA. We know that HIPAA protects sensitive patient health information from being disclosed without the patient consent or knowledge. Therefore, we need patient opt-in to basically train these models in the first place.
So the basic notion here is we're going to use AI technology to put healthcare back in the hands of people and patients.
Therefore, for our recommendation, we recommend investing in clerical and administrative AI technologies such as Abridge to alleviate physician burnout, improve patient experience, and of course, optimize costs. Additionally, we want to invest in deep learning AI technologies that can bolster and improve telemedicine and virtual health experiences of underrepresented patients, a remedial means to some of private equity's past wrongs, and also what we believe to be an untapped option for future growth. Thank you. These are works cited.
Your 3-part question?
Yeah. Actually, let's see what it is.
Okay. First part. Why is there algorithmic bias in healthcare data sets? what are the potential consequences of algorithmic bias in healthcare? How can fairness be established in healthcare with generative AI, such as ChatGPT, by utilizing the open science approach?
Yeah, so we talked about it in our presentation. The first issue when it comes to model bias is basically how the data is sampled. So a big issue is if you're training a model using like an overrepresented population. So we use the example of a data set trained like solely on white patients, then applying that to black patients. So the issue is basically how data is sampled in the first place. And we know that basically like in the 1960s, for example, like healthcare, men and women were basically like on like the same metrics for health data. The same nowadays is obviously, it's not the case nowadays. So obviously you need to create different models to account for these differences. So the biggest issue when it comes to biases, like I said, is simply just the sampling of data sets.
Now, in terms of the problem that this ends up imposing is, like we talked about earlier with the men and women being in the same data set, is men and women are genetically and biologically different when it comes to assessing healthcare. And those differences exist between different ethnicities based off of past experiences, how you were brought up, maybe diet, predisposed illnesses, and a lot more. So when it comes to actually assessing a healthcare plan to get over some sort of medical illness, it's not the same strategy for every single person. I personally have really bad acne, and well, Adam does not. I have to take medicine for it, he does not. I can't eat chocolate, maybe he can. But it's different for every single person, and you can't assume that all healthcare is going to fit the same for everyone.
Yeah, so back to the last question, basically how can we fix this? So once again, we have to go back to how we sample the data. We were thinking that to solve this, you have to just create different models based on different data sets to account for differences in a population. So you'd have a model for a certain demographic, you have another model for a certain demographic, and once again, you have to make sure that these data sets are accurately representing the people that it's going to be predicting, generating an output for. So like I've said it a million times, but the main thing is really just how the data is sampled, and this comes down to, I guess, who's working on these projects, whether you have accurate statisticians. So thank you.